dog who had bladder stones that had traveled down his urethra and kind of stuck there. And so the dog wasn't able to go to the bathroom, needed a surgery to be able to clear the urethra again so that it could urinate. And there are surgeries that can be done where you're essentially cutting into these delicate structures, but that can lead to complications like scar tissue that would, cause problems. And there are procedures now where they can take a basically an endoscope with a laser fiber and internally pass it up and use that laser to destroy the stones, so you don't have to do any type of surgery. It just pulverizes the stones and then they flush them out, and you've just solved the problem without having to resort to a pretty complicated procedure. Most veterinary hospitals, of course, have X-ray machines, and I think just about everyone's aware of that. But we've changed over recently where rather than using the standard film, we now have digital X-ray, which is good in that we're able to take images nearly instantly. We can make adjustments. The really neat thing about this is that we get the images right away, and we take the opportunity ourselves to look at them and try to interpret them. But we also send them through email to radiologists, to specialists. So within a number of hours, we end up getting back a report from an expert. You may have a dog that has, possibly like a seizure disorder or a tumor in its brain. You may have a dog that has an eye problem, like glaucoma, and you need a surgery to take care of it. And that's when you're going up to yet another level of knowledge where you may need, a veterinary ophthalmologist or a veterinary neurologist or an orthopedic surgeon, which also generally will increase the cost because now you're paying for that level of technology and knowledge that they have.